Yes, we're live. Welcome back to our podcast, to the show, everyone. And today we're gonna talk about BluLumen Pro and the growing interest around advanced light therapy in wellness and clinical practice and home use. Our guest for this podcast, there's two, a practitioner, a practitioner, and her patient. Dr. Colleen Ryan. She's a naturopathic doctor who focuses on root causes and holistic health. She has personally experienced Blue Lumen Pro, incorporated it into her practice, and has seen meaningful feedback from patients. So we also have, again, another guest. She'll introduce it later on, who will share her personal experience. So let's bring in Doc Colleen. Doc, how are you? Good afternoon.
Hi, how are you, everyone? I'm really well. Thank you for asking.
Thank you for being here on a Sunday afternoon. And I know it's like this is precious time that you gave us, and we appreciate it. Now, before we talk about the machine, let's understand your approach to health and healing. Maybe you could briefly introduce yourself and share your philosophy as a physician.
I work with frequencies. I'm a doctor of natural medicine. And I've been in medicine for 30 years. And I took a switch because I wanted to do root cause and learning the root cause of things instead of doing allopathic. So I work with frequencies. I work with the blue light. I work with other modalities. I just put the blue light into my clinical practices with my clients, and I've been getting phenomenal results with them.
Now, every practitioner has a reason why a certain modality catches their attention. And you did mention about blue light. So, what first drew you to frequencies, light therapy, and what specifically caught your attention about blue light, Blue Lumen Pro?
Well, I've been working with frequencies for a very long time, and I could treat people remotely with some of the modalities that I have. And I've worked with red light before, and I was at a show that I met all of you, and I was very interested in the differences with the red light and the blue light and what the blue light does. So I received one, and then I started using the blue light on myself, and first to see what kind of results I was getting, and then I moved to my clients. So the experiences I had with myself is I had a dog attack me, and I was in significant pain, and I had gone to the orthopedist, and it was real difficult, and I did not want to do any invasive therapies. So I started using the blue light on my arm. I couldn't even pick up a cup of tea. So it was real serious. And so I started using the blue light, and I saw marked results. I mean, I was using it back to back, back to back, back to back, so I just was pushing because I couldn't hold my cup of tea. And so then I saw the results with that. And then I had fallen, and I hurt my foot, and I couldn't walk. And I said, "Oh, I think I broke a small bone in my foot." So I put the blue light on there, and I was very specific of using it several times in a row again because I saw the results that happened on my arm. So after about an hour or two, I was shocked to see that I could bear weight on it. So I was really, really shocked. And then I moved into several other clients, with one that was in the hospital with pneumonia, and I used the Blue Lumen Pro on her lungs, and it helped expel all of the. She said she coughed up a lot of black stuff from her lungs, so I was really shocked there, and we were able to bring her home because she was septic, and couldn't. Her O2 stats were really low, and so I brought it into the hospital. I started working on her with the blue light, and then she started coughing up a bunch of black residue, which was great. It made her a little nervous, but she did really well, and then I could bring her back to her house and to her family. So that was really well. And then I've used it on several other clients, but I have a client that is here that is a 78-year-old patient that had fallen on 4th of July, and she hurt herself significantly. And so I was able to get to her Monday, and then I'll let her tell her story if you'd like to bring her in.
Yeah, I'm gonna bring her in, but I do have several questions
Sure.
to you. You say it had a great effect. Tell us about detail on what kind of effect, because there's joint pains, there's inflammation, decrease in
Right.
mobility. Which specific symptoms did it help?
So it works really well with inflammation, right? Because we know that inflammation is one of the root causes of a plethora of diseases. So, it works well with trauma as well. My next step is to use it with athletes. So I know when I fell and hurt my foot, I couldn't bear weight. So, and I didn't have hardly any range of motion. So when you ask, it's almost all of those. It's inflammation, it's range of motion. Then I was very surprised to see what it did with the lungs. It brought up all of the black, basically tar in there, tar, and it really helped her with her O2 stats. It raised her O2 stats, and she was able to breathe a little bit better. She was able to kind of wean off her oxygen because she was on oxygen
Wow.
24/7. So, I didn't take her off. She was deciding, I feel a little bit better. I want to try to go without. So she went from continuous to coming off for a couple of hours, then going back on, and then we got her walking somewhat. So, and I used it several times on her. So it was very good for that as well. And so basically all of those things.
That's amazing. How long? What's the duration for the use? Because you said you use it several times, 20 minutes, 30 minutes, 40 minutes. How long before it showed significant, should I say, effect?
Well, she was kind of critical. So I went, 60 minutes, and then I gave her a break, and then I went another 60 minutes because she was septic. So I was trying to get her out of there. I didn't want her in the hospital. Neither did her family. So, because we were very concerned. As far as protocols goes, it's different with everyone according to what's going on and what the root cause of it is. So in natural medicine, we're not mechanistic, we're vitalistic. And we are all a frequency. So we want to treat with the frequencies and biophoton light, so that's the way we go with that.
Were there any downsides or side effects or adverse reactions from using it?
No, but she was able to cough up all that catarrh in her lungs. So people might say, well, that's a side effect. Well, no, it's really not. It's getting to the root cause of why she had pneumonia. It was expelling all of this, the mucus and everything in her lungs.
Okay. I got one more question before we're going to call on our special guest, which is your patient. You did mention about neurological or cognitive wellness, because there's also growing interest in light-based wellness tools, frequencies for people with neuro problems or cognitive disorders or concerns. Have you tried or incorporated BluLumen PRO into your practice as a supportive?
We have a small number. We have a small number, Vince, but we have used it on a couple people with the hat that we have BluLumen PRO, and we see that it decreased the agitation in sundowners, but it's such a small number. But it was significant when we used it on this person. The person, her mom takes care of her in the home, and she did notice a marked difference she has Alzheimer's stage 4. So that's kind of the most difficult. So we haven't really been able to get early stages, which I'm going to phase into next. I'm going to go see some people over in Tampa to see, and we're going to implement it with somebody over there that's just dementia.
I think this would be a good collaboration for us. We could do research on this. We could write some papers in terms of how it affects the patients in different conditions. Moving next because I know she's been waiting for a good amount of time. Maybe you could introduce her before we're going to call her in and give us a background on what happened to her, having her as your patient. And then we're going to show some slides to our audience down here.
Yes. So she's a 78-year-old, very active 78-year-old. She's very into health, holistic, taking care of her body as far as, naturally. And she went up to Washington, D.C. on 4th of July to see the fireworks. And she fell over an electric bike and injured her leg and her arm and her eye. So she's, like I said, she's 78 years old, and she's just full of life and just a wonderful client of mine. And her name is Bernadine. So Bernadine can tell you what she experienced. Hi, Bernadine. How are you?
I'm great now.
So I introduced you and I told them what happened, but if you want to just reiterate or verify.
Yeah, I was like Superwoman. I turned around to find the group I was with, and there was an e-bike lying on the ground, and I flew like Superwoman through the air. And I was shaking like a leaf because it was shock to my system. But the National Guards came up and they said, "Can you walk?" And I said, "No, I can't walk, but I'm concerned about my eye." And there was blood and scabbing, and I had a cut on my arm. It was a skin tear. And they took me to the med tent, which was hot. And they didn't work on me. They worked on everybody else. So I grabbed the wipes that had bacitracin in them. I'm cleaning myself up. They wrapped me up with gauze, and then I went and found my group, and I was dragging that leg, but the eye hurt too. I am way back when. I have a son that's 50, and he was 10 and a half pounds posterior, and I went natural. That was painful. But I started with chiropractors until the last chiropractor. I don't go that often because I became, he twisted my neck when he shouldn't have, and I broke my ankle in 3 places. I have a lot of metal in me, which doesn't make me happy. However, I'm going back to when I had to leave work at 57. I was very sick. I had every autoimmune disease you can think of. And I do not take and refuse to take medication. So I got a machine that was bioelectric magnetic energy regulator. It was called a Beamer. And I was on that machine, and it helped, and I was really into red light. But this leg of mine, it swelled up. It was inflamed. It hurt. And of course, Colleen, she called me, "How was your trip?" And I told her, and she immediately came over, took care of me, put me on a blue light. And I said, "A blue light?" But I know now the red light would not have done what the blue light did for me, because I went to the doctor because I also bruised my lungs, and I had been up like 6 pounds. And I said, "What's that? I'm fussy about my weight. I watch my diet. I eat clean. I drink clean water. How come it's so swollen?" And she said, "You got a lot of swelling and inflammation and liquid in there." I said, "Whew, I thought I gained weight." It came off eventually through the help of the blue light. The pain was, it was like a 10, but my eye was like a 30. I had took a chunk out of my cornea. But the good news is, what people don't know about is that the cornea does regrow. But I had to go and get a cornea patch on it. And within 6 days, it regenerated. Thank God. But getting back to the leg, I did the BluLumen probably a lot. Maybe I did 20 minutes, and then I put arnica on it. Then I took a little break. Then I put the blue light on it again. And I saw a measurable difference. The swelling was coming down. The bruising was horrendous. The scabs were starting to heal, and I could bend my knee. That's something I couldn't do when the injury occurred. So I was very impressed with this new tool that I will probably purchase because I have a trunk load of modalities. Mm-hmm. And I was very impressed. And I thank Colleen for taking such concern, because I am her client, and I'm very grateful for all the work that she does. But we're on the same page as far as belief system. The body has the ability to heal itself. If you feed it right, you nourish it, and you use the proper modalities. So
gonna
I'm
show
very
you some-
impressed.
sorry to cut you off, but I'm going to show you some photos, and maybe you could describe to us what these pictures are. I hope you could see it though.
Yeah, I could see the picture, and I think that might be towards, maybe that might have been yesterday, because that leg looks pretty good. But it's all bruised, it's scabbed. The knee puffed up. Oh my gosh, it looked like I had a teacup on my knee if I had taken a picture from the side. Now that's the side of the leg, and it wraps around to the back of that. I didn't even know I had a bruise in the back of the leg. And when it first happened, I don't think you have a picture where it was just all, the knee was just all scabby. Now this is probably the day before yesterday.
Mm.
And it
Let me go back maybe somewhere here. I guess this is the last one though.
well, I think the first one would have more scabbing. I mean, it was a big, huge, like a whole bunch of water in the knee almost.
Yeah, her range of motion was really limited. She was hobbling when I got to her.
Yeah, it was like if you ever watched Gunsmoke. Oh, I did this. I was trying to get some food for a homeless woman Thursday, and the shopping cart got the best of my little toe, my toe there, and I told everybody it's like a Vienna sausage. Well, but you know what? It's gone. The blue light did it. It's totally healed. The swelling's down, and there's no bruising or redness at all. But
Oh, wow.
I got it quick enough because Thursday I came right home and did it. Being in Washington, D.C., you know, it happened Friday within an hour that I was there. And then I had to come home and get an emergency eye appointment in the morning. And then I saw Colleen later that day.
So
Again,
this is
very
before, Bernadine, am I
This-
correct? This is before, and then we're gonna go to the next one. That's it. How many days is this though? Like nothing happened.
And there it is the next day. It's healed.
It's the next day.
So one day.
One day.
Yeah, it's the next day it's healed.
Excellent.
This one is like 3 days or 4 days after the
Well,
injury.
I don't have my phone with me. I had them in order on my phone when I sent them. It's better, but you can tell that it's better. It's probably, I didn't send one today. It's still bruised today. Yeah, this is quite bruised and painful.
Just a recap, maybe you could share to us, how do you feel right now?
Oh, I feel like I can run a marathon. I exercise too, but I haven't been able to exercise because I couldn't bend that knee. I can bend it. It does hurt. It's still tight though, but I can bend it. I couldn't bend it at all before the blue light. I feel good.
Here's
Is
my last, go ahead, Dr. Lee.
No,
Go ahead,
I was
please.
going to ask you if there's a possibility that you could show us the leg today, or is it too difficult?
No, I could probably, let's see. I need some light. Probably show you. I think that's a good idea.
And you can see how ambulatory she is.
Yeah, she is very ambulatory now. See?
We can see it. Wow.
Yeah.
But
See the side?
it's
It
on the
looks a lot
side.
better.
Yeah.
It's still bruising, but in terms of inflammation, it's not that swollen compared.
No, it's
day or 2
grown
days.
significantly. And she, Bernadine, you could walk better than what you were able to do when I got to you. You're
Oh,
very
yeah. I was dragging that leg like it was an artificial limb. No, I can walk fine now.
Like how soon were you able to walk?
Well, I would say when I came home Monday, maybe by Wednesday.
And that
It
is
happened
how many
Friday.
days? Wednesday. Okay. 4th
Let's
of
see,
July. Is that 5
Friday,
days?
Saturday, Sunday, Monday, Tuesday. It took about 5 days. But I can bend it, but it's still a little stiff. That was a bad injury.
Yes.
When you applied the BluLumen Pro, did you notice something after, like, there's a sensation?
Well, I have to attribute that Colleen was instrumental in opening up my meridians, and I know my body, and I could feel everything just getting into place. So that helped with the healing. And I just felt better after I got off the blue light. You just feel better.
Talking about meridians, so the flow of energy was already open.
Right.
Well,
That really helped her a lot.
I balanced all her meridians as well. When
Mm.
that was Monday night, I balanced the meridians, and then because I wanted it open when I used the blue light,
Mm.
right? So then it would the chi would flow a little bit more.
Here's a personal question to Bernadine. Sometimes the biggest impact is not just physical, but emotional. So, and psychologically, it's like, how does this changes affect your everyday life and your outlook after using BluLumen Pro?
I'm a very positive, faithful person. I was told I had ovarian cancer, and I said, I'm not going to receive that. And I didn't. And I didn't have cancer, but they took everything out. So with the blue light, I know that it's going to do the trick. And I know with my faith, it's going to be healed. I'm going to be 100% next week. I'm just very positive. I do not like any negativity around me or any naysayers. So my mood is great.
So you were able to walk a little bit by Tuesday. You were able to walk better, Bernadine. More weight bearing and more range of motion.
Oh, yeah.
Okay. So Saturday you fell,
Saturday I fell. Yeah, we're talking about the
July.
injury in the
right?
right.
Okay. So by Monday, after you did the blue light Monday night, you were able to bear more weight than what before we worked on you, right?
Oh, absolutely. Yeah.
So Vince, maybe 3 days.
2-3 days.
Yeah.
One other question is, did you take any medications other than having the therapy? For example, some anti-inflammatory, pain relievers, or something?
The only thing I did was put arnica gel on it per Colleen and then the pellets because it was painful. But I'm sorry, I don't. The only time I took medication is when I shattered the ball off of my humerus and my ankle broke in 3 places. And then I broke my toe. I just like to break bones. I'm the bionic woman. Now, I don't like metal in me, trust me, but I had no choice. Oh, they wanted to send me to the hospital in Washington, D.C. And I said, hospital? What am I to do there? I know how to get this fixed. The only thing was my concern for the eye, and I kept on putting eye drops. That was excruciating pain.
You did use blue light on your eyes.
I
No.
did not use blue light on the eyes.
Yeah.
Yeah. Just a clarification, because we might have some
Exactly.
viewers
Yeah.
who will be asking, "Oh, did she also use that for her eyes and it regenerated by itself?" So no, you use it for your trauma on your lower leg.
On my knee and my lower leg. My knee was, that's the 3rd injury to my knee.
And-
Final message to our viewers. Maybe you could say something about, if there are skeptics about blue light, what are your final thoughts about using the BluLumen Pro?
3 years ago, I had a serious injury on that right knee in the bowling alley when the sole of my shoe came off and I went right down. I suffered for 2 years. I couldn't sleep. The pain was beyond belief. With this injury was just as bad, and already the mobility, the pain, and the swelling is down. That's a big difference. Less than a week to 2 years. I couldn't sleep. Of course, I had all the autoimmune diseases before that, but then I had the equipment and that was taken care of. 16 years. Look what the blue light did in less than a week. I'm very pleased. Very appreciative of my therapist, Colleen.
Thank you so much, Bernadine, for being here. We really appreciate you giving your testimony about blue light. And we're going to talk more later on how we would be able to help you out.
Yes, Bernadine, thank you so much for coming on and telling your testimony. I think it's vital that people understand that there are other options besides pharmaceuticals and surgery, right? So the body heals itself. You find the root cause. You use biophoton light. You use natural things. So, thank you for your testimony. I'm grateful for you.
Oh, grateful for you too. And thank you, doctor. It was nice meeting you.
Nice meeting you, ma'am. Now, Doc Colleen,
Yes.
that testimonial is huge from a patient itself. And you as a practitioner, after hearing the stories coming from you and uh, Bernadine. Let's bring things back on your perspective as a practitioner. What stands out to you most about the patient's journey, and what does it represent about the role of BluLumen Pro, the blue light, which can play in your practice?
Well, I would really truly like to see everybody, with a Blue Lumen Pro at home. I mean, to just cut down on the rates of going to the emergency room. Now, obviously, the emergency room is there for a reason, but like with her, she didn't want to go, and she wanted to heal naturally. With me, when I fell and hurt my foot or the dog attacked me, I wanted to do it naturally. So I think it's a very powerful tool to have in your home, to treat yourself. I shouldn't say treat yourself. To use the light to let the body work the way it's supposed to, because I'm putting it in the right environment. So we're really not treating anything. We're letting the body get the right environment, and then the body heals itself.
Thank you so much for sharing your experience and your clinical practice, and inviting Bernadine for being here. And to our patient guest, Bernadine, thank you so much for being here and for being open and honest, Doc Colleen, about not a journey. I guess this is the beginning on the use of Blue Lumen Pro Blue Light Therapy. One more thing, invite people to your practice. How can they contact you? What's your Facebook page? What's your website? So if they have any questions, they could go
Yes,
directly to
they can
you.
call me directly at 407-473-2749. That's 407-473-2749.
I'm gonna write it down. It will be down there in the comment section so that they would easily reach out to you. Final thoughts, final message before we go.
Yes, Vince, I think that, we are moving into a phenomenal time in medicine. I think that these technologies that are coming out, like the BluLumen Pro, people are going to be amazed at what these technologies can do and how it helps the body to put the body in the right environment, so the body will heal itself without doing any harm, right?
We're supposed to go, but I got a private message.
Yes.
She got a question. What would you say to someone who is considering Blue Lumen Pro but is still hesitant or skeptical about it?
Well, everybody's skeptical about light therapy or frequency. And I tell them, you know what? When I picked you up on the ambulance and I put an EKG on you and I'm getting feedback, that's you, you're electrical. And if you go into cardiac arrest, I'm using frequencies. Light is a frequency. And so we need to start looking at this a little bit differently, because it's very powerful. Because everything we do, if I do an EEG, that's a frequency coming from your body. If I do an EKG, it's a frequency coming from your body. And everything has a frequency. Every disease, the blue light, the red light, they all have frequencies. So, like I said, we're going into an exciting, exciting time in medicine, that new technologies are going to be pouring out. And I would advise people to have an open mind and to let your body heal itself and get to the root cause of the issue. And let's heal from the inside out.
For everyone who's watching right now or listening, we will be going deeper on this Blue Lumen Pro in our upcoming webinar and podcast. And I'll be inviting you more often on several podcasts. So whether you are a practitioner interested in bringing this technology, like Dr. Colleen has been saying, into your own clinic, or you are an individual interested in learning how it may be used responsibly at home, we'll have podcasts, we'll have webinars. We're going to talk you through the Blue Lumen Pro system and its applications, general protocols, and important safety considerations. So all you have to do is click the link below. We have Dr. Colleen's phone number I'm going to put it right down there on the comment section. So if you would need her, and she's based in Florida. Am I correct with that?
Yes,
You
I
haven't
see
mentioned that.
people up from Orlando down to Miami over to Tampa.
Hmm.
So we can do even in other states. We do remote as well. But for the blue light therapy, we also you need to be in person, right? So or we can get you one in your house.
And I'm your host for this afternoon's podcast, Doc Vince, and here with me, Dr. Colleen Ryan. Thanking each and every one of you. Have a great day. Have a great afternoon. Happy Sunday. And to Miss Bernadine, thank you so much. Bye bye.
Bye bye.